bringing us that report. Now, moving on to what's brewing today, employee health benefit platform Plum has announced its foray into the direct healthcare vertical with a 200 crore rupee commitment for Plum Health Checkups, which is a new at-home screening solution. Now, with this investment, Plum is transforming from an insurance company into a full-stack healthcare platform. It now plans to expand its team fivefold to support the shift. For more on what the foray means for the company and how it will boost their growth going ahead, joining me now is Abhishek Poddar, the co-founder and CEO of Plum. Abhishek, welcome to Startup Street. Thanks for your time here. You've committed 200 crores to the healthcare vertical, a large figure. It is a shift from your insurance roots. From a financial lens, what kind of business outcomes are you targeting in the next 2-3 years and the revenue contribution from this new vertical?
Hi, Ritu. Thank you so much for having me on the show. It's great to come back. Our 200 crore commitment that we have made over the next 5 years, it truly is a bold strategic evolution for Plum from a single product corporate health insurance platform to a more integrated full stack healthcare company that we want to build. In the next 2 to 3 years, this investment is expected to drive strong triple-digit growth in our healthcare vertical that we have been slowly building over the last year and a half. We actually expect our healthcare to contribute anywhere between 30 to 40% of the total revenue in the next 5 years by 2030. So our healthcare vertical actually has been the fastest growing segment. We have been expanding by 125% year on year with a very healthy gross margin. But what's truly compelling as we have done this over the last year and a half is we saw over 60% of the first-time insurance buyers were simultaneously opting for healthcare for their team in addition to insurance. That means there was a latent demand for comprehensive healthcare plan for their employees. For every 100 rupees that an employer would invest, they would see an average of 296 rupees in employee healthcare savings. So this creates a virtuous cycle of adoption and recurring revenue for Plum, but also a very clear, very measurable ROI for the customers that we are partnering with.
Well, that's a significant contribution that you're talking about from this new vertical. How will your revenue model itself evolve? I mean, will these healthcare services like checkups, etc., are they going to become direct revenue drivers, or will they be primarily used for acquisition or retention?
So they are going to be direct revenue drivers for us. Our revenue model is evolving beyond just a transactional insurance to create a more holistic healthcare ecosystem. So our revenue stream so far hinged mainly on insurance premiums that we provided through group coverage. Now what we are doing is we are layering in this recurring revenue that comes from preventive care, such as the annual preventive health checkups that we launched, telehealth consultations, OPD wallets, and this transition is really designed to move the employer spending from just a reactive payout that happens via insurance to a more proactive health management for the employee and the employer.
Got that. But Abhishek, this is a large investment. You're talking about 200 crores. How will it impact your profitability? And also, how immediately will you have to go for another round of funding? And will you be on track for sustainable margins in the next 2 years or so?
So just a bit of background. So we as an organization have actually been profitable at both EBITDA and cash flow level for the last 2 quarters. So our investments into healthcare is a very disciplined, a very high confidence investment that we are making to actually accelerate our growth in both top line and bottom line that we generate. Our investment is going to come primarily from the existing cash flow reserves that we have and the profit that we have started to generate from the core business of group health insurance. But that said, because you was asked specifically around funding, so like any fast-growing company at our stage, we are always open to further capital infusion, especially if it is helping us accelerate that mission that we have to impact the health of 10 million lives.
All right. There are several health tech startups in India that offer these kind of preventive solutions. What will be your edge, especially now as you straddle both insurance and healthcare services under the same umbrella?
Yeah, I think our advantage really is building this single unified platform that is very seamlessly blending insurance with a more personalized healthcare. So unlike a legacy broker or a single product player that exist in the market, our approach is one, how do we integrate this financial protection with a preventive engagement, employees receiving regular checkups, teleconsultations, diagnostics, mental wellness support, wellness perks under one roof. Number two, we are leveraging AI a lot, especially for personalized risk assessment. Think of customized health reports. Think of actionable insights that it can generate for the individuals. Number three, we are also building a nationwide access. So whenever we launch health checkups, it is available India-wide through our 4,000 plus partner locations, and it is very digital first management. And lastly, we are very focused on outcomes. It's not just transactions. Our data, in fact, tracks the employee health risk over a long time period and really helps them improve the actual health of that individual. So it's going from a transaction to a very impact-driven platform that we have built.
Abhishek, quickly, I know you're focused on health outcomes, but the outcomes your investors are looking at, revenue and profitability. What are the targets for the next year or so? And secondly, what next for Plum in terms of any other white spaces you're looking to fill in your overall offerings?
No, absolutely. So over the past 5 years, we have truly become the health partner of choice for the India's most forward-thinking tech companies. Think of companies like Zomato, Swiggy, Zerodha, as well as the trusted ally for all the founders who are even starting their company, even a 5 or a 10 people company. We have become that partner of choice. For us, the next natural step in our growth is bringing the same tech-driven, very integrated healthcare approach to the more traditional enterprises. Right now, we have experienced how to provide this to 6,000 plus organizations. Our track record has demonstrated that reliability and scale. Now we want to leverage this experience to really challenge the legacy insurance brokers. This market of employee health insurance, employee health benefits is over a 100,000 crore market in India. Our goal for the next 5 years is how do we get to that 10% of the market, right? And the 10% of the market is a huge premium. That means Plum managing over 10,000 crores in premium, right? So that is the kind of goal. It's ambitious, but that's the kind of goal that we have taken. So that's more on the top line. We continue to build this business in a very sustainable way. We want to continue to be EBITDA profitable, but we want to do all of this while staying very close to that vision of how do we drive healthcare impact.
Got that, Abhishek. That's all the time we had, but thanks very much for joining us here today. And we wish you the best and wait to hear more on what Plum does. Thank you
so much.
All right. Also on what's brewing, B2B commerce company Moglix is making